Welcome to the What If It's Not Depression Vodcast. I am your host, Dr. Achina Stein. Today, I am introducing Dr. Eric Osansky. He is a chiropractor, clinical nutritionist, and certified functional medicine practitioner who helps people recover from thyroid and autoimmune thyroid conditions. I'm so excited that he is here because we've talked quite a bit about hypothyroidism, but not necessarily the other extreme, which is hyperthyroidism. And I've recently reached out to him to consult with me on one of my patients who might be looking like a hyperthyroid patient. Anyway, he is author of the books, Natural Treatment Solutions for Hyperthyroidism and Graves Disease, and Hashimoto's Triggers. Hashimoto's is a type of hypothyroidism, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed in 2008 with Graves' disease, and after taking a natural treatment approach, has been in remission since 2009. After seeing how well natural treatment methods helped with his condition, he began using these natural thyroid treatment protocols to help others with different types of thyroid and autoimmune thyroid conditions, including hyperthyroidism, Graves' disease, hypothyroidism, and Hashimoto's thyroiditis. If you like this episode, and even if you love this episode, please click the like button and subscribe to my channel. Welcome, Dr. Osansky.
Thank you. Thank you, Dr. Stein. Appreciate you having me.
Yeah. So, let's dive in and talk about your personal experience with hyperthyroidism. Tell us how it started. Before you even knew that it was hyperthyroidism. Can you talk about those kinds of symptoms? Because sometimes it kind of creeps up on you and it takes a while to figure out that it is your thyroid. So I'd love to hear the backstory on all of this.
Sure. So what was happening is that I was doing some dieting and detoxification and everything was going well. And just when you do that, one of the goals is to lose weight. So I was losing weight and then all of a sudden, a few months into that, I was at a Sam's Club and just walking around and the Sam's Club had one of those automated blood pressure cuffs. And so I sat down, decided to take my blood pressure, and my blood pressure was perfectly fine, but I had an elevated resting heart rate, and which isn't common now and wasn't common then. So for the next few days, I would just continue to take my resting heart rate at home, and it was anywhere from like the low 90s to the maybe 105, 110. And so I knew something was up. And at the time, I wasn't too familiar with hyperthyroidism. I mean, I learned about it and I attended some conferences, like endocrinology conferences where they spoke about it, but they focused more on hypothyroidism, even, this day and age. So I started putting the pieces together, the elevated heart rate. I was losing weight, which I thought was just due to my dieting and exercising. But then I was paying more attention to the symptoms and realized that I was having palpitations. And, at first they were just start out mild. So I wasn't aware of them. But then finally I did end up going to a primary care doctor, got some blood tests, just some basics, the TSH, and maybe it was free T3 and free T4, definitely free T4. A lot of them just will test the TS. Some will just test TSH, but I know I got at least the free T4. And sure enough, it revealed hyperthyroidism. And a few months later, I went and saw an endocrinologist who did some additional testing, and we could talk about some of the tests, and they diagnosed me with Graves' disease. And it was a surprise, just like it is with most people who are diagnosed with hyperthyroidism, Graves' disease, or any other health condition. Many times it comes as a complete surprise. But yeah, some of the symptoms, again, I mentioned a weight loss, elevated heart rate, palpitations, and increased appetite. I had a voracious appetite, and I didn't have. There are other symptoms. And again, we could talk about these other symptoms that I didn't experience, but other people with hyperthyroidism experience. But that essentially is my story.
Okay, great. Yeah. So once you had the blood work, what was recommended for you to do?
So after I saw the endocrinologist, well, when I saw the primary care doctor, I think he just recommended a beta blocker at the time.
Mm-hmm.
And then I scheduled an appointment with the endocrinologist.
Just so the audience knows, a beta blocker is a medication to bring your blood pressure down and control heart rate.
Correct. Yep. So yes, the recommended the beta blocker to help with the resting heart rate in my case. And then when I saw the endocrinologist, she recommended something called methimazole, which is anti-thyroid medication commonly prescribed to those with hyperthyroidism. And going into that, I will say I kind of knew in the back of my mind that I wanted to take a natural approach. And so I ended up not taking the methimazole, which many of my patients do take the methimazole. So I'm not telling people not to take that, but that was the recommendation, pretty much take the methimazole and just wait and see approach, I guess you could say. I only saw the endocrinologist for a single appointment. But yeah, I will add that was a more conservative treatment recommendation. A lot of the endocrinologists will recommend radioactive iodine, which is ablating the thyroid gland, and some will recommend thyroid surgery, complete thyroidectomy. So she didn't recommend that in my case, but a lot of people, when they go to an endocrinologist, they're pushing them to get either surgery or radioactive iodine.
Right, right. Did you have a thyroid scan completed as well as part of the testing?
I didn't have, many times I'll do a thyroid uptake scan, radioactive iodine uptake scan, but they didn't do that. And what I wanted, she actually didn't even want to do an ultrasound, a thyroid ultrasound. And she did palpate my thyroid, and she didn't detect any nodules through palpation, but I talked her into doing a thyroid ultrasound. So I got the ultrasound, and it was clean. So she was right, but I wanted that reassurance.
Right. Yeah, I mean, because your fingertips are limited in so much, and some people are better than others in detecting nodules. You have to really palpate thousands of thyroids to really notice the difference between a nodule and the grittiness and the fullness and all of that. So it does take a lot of experience to do that. So when you decided to do well, let's talk less about you and really just shift into what it is that people in general should know about hyperthyroidism and how it shows up and the different kinds, and that way, we can just try to hit as many areas as possible so that people understand the depth and the breadth of these conditions. And so if they sort of fit into one of these, then they'll know what to do. Can you talk more about hyperthyroidism and how it shows up?
Sure. So with hyperthyroidism, that typically on a blood test, you have elevated thyroid hormone levels. So that the thyroid hormones are T3 and T4, and there's different ways of testing it. Like in my practice, I like to look at the free T3, free T4, which means that they're free in the bloodstream. A lot of times, the medical doctors will do total T4, or it might just be called thyroxine, total T3, and most of that is bound to a protein. And of course, you could do both. You could do total and free T4, total and free T3, but thyroid hormone levels will be elevated. And then you have something called thyroid stimulating hormone, or TSH, and that actually is a pituitary hormone. So that in many cases is depressed. And it depends on the type of hyperthyroidism. With Graves disease, usually it's undetectable, and even in other types of hyperthyroidism, which I'll talk about. And the reason is because with TSH, like in hypothyroidism, you have low thyroid hormone. So that TSH usually rises to signal to the thyroid gland to produce more thyroid hormone. But with hyperthyroidism, you want the opposite. Since you have too much thyroid hormone, the body's suppressing that TSH production because it doesn't want to produce any more thyroid hormone. So typically you'll get low TSH and elevated thyroid hormone levels. And then there are different types, as we mentioned. So most cases of hyperthyroidism are autoimmune and what's called Graves disease. And with that, the way you differentiate Graves from other types of hyperthyroidism, at least one way, is by measuring antibodies. And the name of the antibody, thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. And so that typically will be elevated. And medical doctors, specifically endocrinologists, will use sometimes other methods, like you mentioned, the uptake scan. Sometimes they'll use that to diagnose Graves' disease if someone has an elevated uptake scan. But in my opinion, if the antibodies are positive, that's good enough, at least for diagnosing. There could be other purposes for the uptake scan to detect hot and cold nodules and all that. But and then another, sometimes a common condition with Graves' disease also is what's called thyroiditis. So sometimes, even without doing the testing, if someone walks in and they have hyperthyroidism and they have like eye pressure or eye bulging or other eye symptoms, that's still not, I mean, you could say maybe in some cases diagnostic, but usually they'll still want to do either the uptake scan or the antibodies. But essentially, if someone walks in and they have like the eye bulging and the hyperthyroidism, then you could be pretty confident they have Graves' disease. And yeah, so, and then there are other types. So toxic multinodular goiter is when someone has, well, multinodular goiter is when you have multiple nodules in a presence of a goiter, which is a swelling of the thyroid gland, inflammation of the thyroid gland. And so the toxic part means that you have hyperthyroidism, because not everybody that has a multinodular goiter has the hyperthyroid component. And again, most people, if it's clearly hyper, will have that depressed TSH, that undetectable TSH with that toxic multinodular goiter. And there's subacute thyroiditis, which usually is more transient. It's usually viral induced. And typically the person will experience it for a few months, sometimes less, sometimes only a month, but could be like on average, like 2 to 4 months. Many of them will switch to hypothyroidism, but while they're hyper, again, similar presentation, depressed TSH, elevated thyroid hormone levels. And really they're ruling out Graves' disease as far as like how to tell. They'll do a thyroid scan or a thyroid ultrasound. And if there's, if that looks clean and Graves is ruled out, then again, and there's the presentation also sometimes what most thyroiditis, it's subacute, so you can't go by pain. So that's but those are the three main kinds. I will add there's also hashitoxicosis, which is Hashimoto's, but also presenting with transient hyperthyroidism. The duration varies from person to person. So someone can come in and feel like they have Graves, but they might actually test negative for the TSI, but test positive for the thyroid peroxidase and or antithyroid globulin antibodies.
Right. And those are antibodies for Hashimoto's. I was one of those people. I was on a roller coaster. So I had high levels and then low levels and high levels. I was really on a roller coaster for that for a period of almost 2 years before it kind of burned out, so to speak. And then I was placed on the medication levothyroxine for hypothyroidism. Yeah.
Yep.
So yeah, people have different courses, just the way that you explained it perfectly. Can you talk more? I know you didn't have all the symptoms of hyperthyroidism, but there are lots of other symptoms that people can have that can present as hyperthyroidism, and it's something to be important to know about, so that there is some index of suspicion to really pursue testing in this regard. Can you talk more about those other symptoms?
Yeah, well, again, the classic symptoms of hyperthyroidism, you got the elevated heart rate, elevated resting heart rate, heart palpitations. You have tremors sometimes. I had tremors, but not everybody has tremors. Voracious appetite because that increased metabolism, weight loss, very common. I lost 42 pounds. That being said, some people don't lose weight, or some people actually struggle to, even with hyperthyroidism, to lose weight. But that's one of the classic symptoms. Loose stools, and we're going to talk about anxiety. So not everybody experiences anxiety, but that is also a pretty common symptom. I mean, some people experience depression too, but I would say with hyperthyroidism, I see more anxiety. And again, I mentioned the thyroid eye disease.
Right.
It's
What about
so again,
insomnia?
yes, yeah, definitely, yeah. The
Yeah, insomnia is a big one.
good call. Yeah, insomnia is actually very common with my hyperthyroid patients as well. So yeah, that's I mean, sometimes you get symptoms like fatigue, but again, like when I experienced hyperthyroidism, I was so revved up and I didn't really experience fatigue. But a decent number experience fatigue. It's more associated classically with hypothyroidism, but still, especially if someone's been dealing with hyperthyroidism for quite some time, it could take its toll on the adrenals. And like you just mentioned, if they're not getting enough sleep because of insomnia, then
Right.
that of course could lead to fatigue. But
Right.
it's more of an indirect symptom, in my opinion, and not necessarily directly caused by the hyperthyroidism.
Yeah, you explained it really well by using these two words, revved up, right? So it's almost being in high gear and never being able to downshift. You're stuck in high gear. So insomnia, night sweats, everything is working faster. All your organs are hyper metabolizing. So that's why you're losing weight. That's why you're sweating. Everything is on overdrive. And so much so that you can't calm your body down enough to rest, meaning sleep. So, and I would imagine, especially with the increased stool, stool to the point of having multiple bowel movements and to the point of diarrhea for some people, their food is going down that conveyor belt of their GI tract, that it's going so fast that your body is unable to absorb and assimilate all the nutrients because it's just flying by, right? If you imagine it like a conveyor belt and your body gut lining is trying to pull all the nutrients from those foods, if it's flying by, you're going to lose a lot of that nutrition right into your poop. So you become malnourished as well. And so it just becomes this downward spiral.
Yep. I
Yeah.
agree.
Yeah. So what is it that you find? I feel like, you and I've talked about a particular patient, and I have been on the what's the word, fence on the fence about these two patients because they appear to have some of these symptoms, but their TSH isn't too low, and their free T4 and their free T3 are borderline but not high. Would you consider them clinically, because of their symptoms, clinically hyperthyroid? Have you ever seen cases like that?
Yeah, it's not unusual. We see different types of cases, but that the classic case is again that depressed TSH, elevated thyroid hormone levels. Sometimes we have someone. Actually, it depends. Like sometimes with the multinodular goiter, the TSH won't be completely depressed. So like completely depressed, depending on the lab, might be less than 0.005 for that TSH, or some will say like 0.001, where maybe someone might be 0.3, 31 or something, which is, so still detectable. And the thyroid hormone levels, usually in that case they might be mildly elevated, or they again might be on the higher side. So that sounds similar, but I think in your patient's case, I think the TSH might have been within normal range, right? I don't remember exactly.
Within normal range, but low normal.
Yeah. So
like 1.1.
yeah.
Right? Not so, and of course, every lab has a different range. And it's amazing how much the lab ranges shift from lab to lab. So it was I would say in the 5th percentile. And so, gosh, she's losing weight. She can't put on weight. She has a lot of anxiety, insomnia, that revved up, ruled out all these other things going on.
Yep.
And I have a gentleman who's kind of in the same boat, look, and it's just like, is this hyperthyroidism? And so trying to figure out what the next steps would be is what I'm moving towards. Should I get a thyroid scan? Should I get the TSI levels? And that's what I'm going to be doing. So these are the kinds of things to try to really nail it down. But what I love to do, instead of waiting for a diagnosis, sometimes unfortunately what doctors do is they spend all this time nailing down a diagnosis, and getting a diagnosis is important. But if you see somebody all revved up, there are certainly things that you can do in the meantime, right, to settle their system. And so we talked about some of the conventional treatments about, if you have the diagnosis, you mentioned, medications, methimazole and surgery, are some of the treatments if this is like really extreme and serious. But there, in those in between cases, what is it that you can do to sort of, reverse some of this, which is probably due to inflammation, right? Root causes of inflammation, but I would love for you to sort of really narrow it down specifically to thyroid conditions, what those root causes, the most common root causes are, and what those natural treatments could potentially be for those people.
Sure. Well, before diving into that, one thing I want to do, I do want to mention is you want to be safe when you have hyperthyroidism. So, we mentioned a medication I mentioned I did not take the medication. So what did I do when I had hyperthyroidism? I did look to address the root cause, which we'll talk about, but I chose taking an herb called bugleweed, which is an herb with anti-thyroid properties. And it's not effective with everyone. So I would say maybe like 70% of people. And that's why if I have a patient and if they've seen an endocrinologist and they're already on methimazole and they're doing okay and really not having side effects, I would never, encourage them to stop that and, take bugleweed. You just never know if it'll work or not. On the other hand, if someone's not doing anything, and if they're really opposed to taking the medication, then bugleweed might be a good place to start. And I also added what was called motherwort, which more, I think of it as more of a natural beta blocker. It's more focusing on a cardiovascular effect. So like in the patient you just mentioned, again, I don't know if I would give bugleweed, just like if that patient went to an endocrinologist office from a symptomatic standpoint, the endocrinologist probably would not want to give methimazole because TSH is, again, there's optimal ranges versus lab reference ranges, but it's still that, of course they don't look at the optimal ranges, but either way, they would not, based on those numbers, would not give methimazole. And again, to be fair, I probably wouldn't recommend bugleweed. I would recommend maybe something like motherwort or hawthorn, herbs to focus more on the cardiovascular system. And then, or maybe even something like lemon balm, which does have like more mild anti-thyroid effects and a calming effect. And then, as you mentioned, try to address the root cause. And so, there's so many different directions you could go when it comes to looking at root causes. But, so in my case, I had adrenal saliva testing done and my adrenals were pretty much shot. Everything was low in my case. There's different patterns with adrenals. So, I had low cortisol, low DHEA, low what's called secretory IgA, which lines the mucosal membranes of of different areas of the body, including gastrointestinal tract. Looking at nutrients, gut health is important. And, even when talking about anxiety, most of the neurotransmitters are in the gut. And there's been, I'm sure you're aware, a lot of research showing the relationship between, the gut microbiota and mood disorders, both depression and anxiety. And so, gut health is also important really with any condition, but especially with autoimmunity. So with Graves disease, there is what's called the triad of autoimmunity. Well, not just with Graves, but autoimmunity, there's the triad of autoimmunity. So there's which is a genetic predisposition, exposure to one or more environmental toxins, and then an increase in intestinal permeability, which is the medical term for a leaky gut. And so really when trying to look for root causes, we're looking for different triggers. Food could be a trigger, such as gluten, dairy. Stress could be a trigger, environmental chemicals, including heavy metals such as mercury, infections such as H. pylori, Epstein-Barr. And again, this is, these are in the literature. Again, some will say correlation doesn't always mean causation. But again, I would say from what I've seen in practice, it's not always like a lot of people have Epstein-Barr, I think 95%. So most people, I would say that's not the trigger, and maybe it's more of a contributing factor in some cases, but either way, trying to improve immune system health, try if you have H. pylori. Again, there's different perspectives on that too. But if someone has Graves and H. pylori, I would recommend treating it. But yeah, just trying to remove the triggers, healing the gut, since the gut is so important for optimal health. But that pretty much in a nutshell is a summary of what I recommend and, things I look for. And, we could always get more specific, but it does depend on the person. It just depends on the health history. If someone comes in, and you can't always go by symptoms, but if someone fills out their health history, and if they're having a lot of digestive symptoms, you better believe I'm going to recommend some type of comprehensive stool panel. It doesn't mean if someone's asymptomatic and if their gut health feels fine, that they're not going to have any, gut bugs, any gut infections or anything going on. But you got to be, at least in my opinion, I try not to go too crazy with the test. So, I try to use, there's some testing like saliva testing, adrenal testing I like, but anyway, it depends on the person.
Yeah. No, that's great. Yeah. You basically covered all of the areas, foods, infections, toxins, stress, and hormones, particularly cortisol. So yeah, I think you covered the entire gambit of root causes, and which is the case for many conditions, not just hyperthyroidism. So
Right.
thank you for your review of some of the herbs that people can use. I'm
Okay.
curious about whether or not you have had patients taking medications for hyperthyroidism, as well as some of these herbs, or should it be one or the other, or do you sometimes have patients doing both? Because I think it's important for people to be safe. I completely agree. And when it comes to certain medications, certain conditions, you really have to be careful about combining certain treatments. And we're certainly working with a practitioner rather than just assuming that things are safe. I always tell patients if they're on, for example, for depression, if they're on SSRIs, which is a class of medications commonly prescribed for depression and anxiety, that you really have to be careful about taking adrenal supplements or 5-HTP or tryptophan, GABA, some of the supplements. So I'm curious about what your experience has been with medications for hyperthyroidism and herbs.
Yeah, that's a good question. So sometimes I do. So when someone comes and when I'm working with someone, and let's say they're taking just antithyroid medication such as methimazole, or there's also PTU, but methimazole is more common. But either way, I usually don't recommend bugleweed unless if they really want to get off the medication, which you would think of course, everybody, that's a long-term goal. But as I mentioned, when someone's experiencing those symptoms, it's really, really horrible. And then when they're on the antithyroid medication and they're feeling better, again, some people are nervous about making the transition, even if I were to encourage them, which as I mentioned, I don't. And I'm not a medical doctor, so I can't tell someone to stop taking a medication. But if someone sees me again and they're taking methimazole and they're like, I really don't want to take it, or I'm having side effects, that's also common. Methimazole commonly will cause side effects. And they might be like, well, if I don't take it, then pretty much the next step is radioactive iodine or thyroid surgery. But your question was, can they take it both at the same time? If they're not experiencing side effects, but they just want to get off of it, again, I won't tell them to get off of it, but I might put them on bugleweed at the same time as the methimazole, usually telling them to take it about an hour apart. And then just basing it on the test. They're usually working with an endocrinologist if they have a prescription for methimazole. So if they're on bugleweed and let's say methimazole, and then they do a follow-up thyroid panel a month later and things are shifting towards the hypo side, then usually the endocrinologist will decrease the dose of methimazole. Now, it might be slowly that they decrease it, but still it's heading in the right direction. So that's usually the approach that I would recommend. I would never say take both and then after a month, again, for them to stop, even if they're doing it on their own terms, I would discourage that. And then sometimes if someone is taking, let's say, methimazole, but they're still experiencing some palpitations, then I might say, of course, continue taking the methimazole, but maybe add motherwort. So the medical approach might be, well, why don't you add a beta blocker like propranolol or metoprolol or atenolol? But again, depends on the person. If someone prefers to take that route, that's fine. But yeah, so those are like two scenarios where I would recommend,
Right.
taking herbs at the same time. And one more would be lemon balm, like you mentioned, insomnia. There
Right.
could be different causes of insomnia. It's not always the hyperthyroidism, but if someone's taking methimazole, and even if they're taking methimazole and a beta blocker, usually I recommend the lemon balm towards the evening, and I usually have no problem having them take that with the medications.
Right. Is there anything that you give for the weight loss or the loss of appetite and weight loss?
Not specifically, and the reason for that is because you got to address the cause of the weight loss, which is the hyperthyroidism. So
Yeah.
people come to me all the time, especially with those who are losing weight, and they ask, well, what foods can I eat? I'm losing all this weight. What can I gain? And of course, I'll encourage them to eat a nutrient dense diet, maybe eat, increase the amount of healthy fats, maybe eat an avocado per day. But honestly, it has minimal effect if those thyroid hormones are quite elevated. And that's usually they need to take either the medication or, again, an herbal approach. That's why I'm saying initially you want to be safe because the elevated thyroid hormone levels, again, the weight loss and the voracious appetite are uncomfortable, but you can have more harmful symptoms, cardiovascular symptoms, arrhythmias if you're not careful. It could affect bone density. So that's why, again, it's not just about addressing what all autoimmune conditions. Again, you want to address the cause. And even like you mentioned, Hashimoto's, there's like levothyroxine, but with hyperthyroidism, you definitely want to be safe in whatever approach you take.
Right, right. So yeah, it's interesting because you mentioned a voracious appetite. And have you ever had a patient where they had no appetite, though weight loss, having hyperthyroidism because of the anxiety due to, they're all hyped up, revved up. Sometimes when people get really revved up, they have a loss of appetite. Have you ever seen that as well?
Sometimes. Yeah. I mean, it's not as common. It's the increased appetite is more common, but yeah, I've seen people where they're losing weight and they don't have an appetite. And that could be tied to that. Again, it's not a classic symptom of hyperthyroidism, but not everybody follows the classic pattern. But of course, it could also be other things going on as well.
Right. Like gut dysbiosis, which can cause increased gut permeability. Yeah. It becomes, there's a point where sometimes when people have this weight loss and they're so concerned about the weight loss, and you're right that, we have to get to the root cause of what's causing them, their metabolism to be in overdrive ultimately. But one of the interventions we usually put in place is being gluten and dairy free, which is another driver of weight loss. So that's why it as you can tell, and I'm hoping that the audience sees that this can be very, very complex, and why it's so important to work with a functional medicine practitioner who understands all of these complexities and be able to work with you and not try to do this kind of thing on your own. So the purpose of this video is purely educational and just to give you some ideas of some tools, but it's probably in your best interest to really find someone who understands all of this and work with people like you, Dr. Osansky, right? Yeah.
Yeah, agree. Yeah, you definitely don't want to, whatever condition, whether it's hyperthyroidism or Hashimoto's or, a different health condition, it's always best to work with a practitioner.
Absolutely. Yeah. So I think we covered all the bullet points we wanted to cover. So we did a great job with that. Thank you. Any last things that you want to say to our audience about this topic?
Well, I guess what I would say is, as I mentioned, at least once, if not multiple times, many people with hyperthyroidism, they're pressured by their endocrinologist to receive radioactive iodine thyroid surgery. And a lot of times family members and friends will also pressure them too. So just, realize that, surgery is not addressing like if someone has Graves, it's not addressing the autoimmune component. Even if someone has toxic multinodular goiter, it's not addressing the cause. Again, there's a time and place for surgery. There's a time and place for conventional treatment methods. So I'm not saying it's never necessary, but use your own judgment and don't feel like you're receiving any treatment because you're being pressured to receive that treatment. So just try to keep an open mind. If you have to take the medication to manage the symptoms, that's fine. There are alternatives like bugleweed and motherwort. But yeah, I would just say, make sure you're safe, do something to manage the symptoms. And then, as we mentioned, work with some type of functional medicine practitioner to try to address the underlying causes, to remove those triggers and heal the gut.
Right. Yes. And I did want to add, and I wish we talked about this a little bit more, that people can have, because we talked about it before we started, people can have significant symptoms of serious depression, anxiety, manic depression, and even psychosis from these types of symptoms. So it's really, really important to make sure that this is one of the things that you rule out. And it's not often considered right off the bat, because you can have low levels of symptoms and not have the extreme symptoms of the eyes bulging. It doesn't have to be that extreme. You can have lower symptoms like what you experience, and to really get the testing done. So I see that you have something to offer to the audience. It's the thyroid checklist, and I will be having that in the show notes, and that all our listeners can find you through naturalendocrinesolutions.com and also savemythyroid.com. Is that correct?
Correct. So savemythyroid.com, that's where my podcasts are held. So if you visit that, click on podcasts. And then Natural Endocrine Solutions, I have hundreds of articles related to thyroid and thyroid health, thyroid autoimmunity.
Oh, awesome. That's so great. Thank you for that, all that information. I'm sure everyone's going to love going there and using your files and archives to try to figure this out for themselves as well. Thank you for joining me today.
Thank you. Thank you, Dr. Achina. Appreciate it.